I'm going to review my patient's chart for their allergies, code status. I'm going to review their vital signs. I'm going to check for their height, weight, gender, and their weight. And then I'm going to gather my supplies, perform hand hygiene, and then I'm going to go into my patient's room. Knock, knock, knock.
Come in.
I'm going to provide privacy and close the door. Hi, my name is Megan Barnes. I'm going to be your nurse today. Can you state your name and date of birth for me?
Amanda Tredechny, January 19th, 1993.
Okay, I'm going to check your bracelet real quick. Okay. Today I'm going to be performing a head-to-toe assessment. I'm going to ask you a series of questions, going to have you do a few things, and as we go along, if you have any questions, just let me know, okay?
Okay.
Can you tell me how old you are?
26.
And do you have any allergies?
I do not.
And are you do you know what your code status is?
I'm a DNR.
A DNR. Can you tell me where you're at?
I'm at the hospital.
And can you tell me either what day or date it is?
It is Wednesday, September 25th, 2019.
And do you know what you're having done here today?
Just some tests.
Okay. And are you having any pain today?
I'm not.
Okay. As I do my assessment, I'm going to check. Oh, I'm going to don some gloves first before I touch my patient. But as I go through my assessment, I am going to check their speech, their appearance. She looks like she is not disheveled and that she has good hygiene. Next, I'm going to inspect your scalp. I'm going to touch your scalp. I'm going to assess for shape and size. And I'm going to look at your hair and look at your scalp. Does anything tender when I'm touching on you?
No.
Okay. I'm going to inspect the face. I'm going to ask you to do a series of things, and I'm going to check for symmetry. So if you would raise your eyebrows for me, and then you can lower them. If you squint close your eyes and very tightly, thank you. If you frown for me, and then smile for me, okay. And then I'm going to, I have a pen and I'm going to shine a little bit of a light in your eyes, and I'm going to check your eyes for the response, okay? All right, if you'll look straight ahead, and then I'm going to shine the light over into this eye and check your pupil response. Good. Then I'm going to check your accommodation. I'm going to have you follow my pen, and I'm going to get close to your face. All right, that's good. And then I'm going to check your nose, and I'm just going to assess for any redness or brightness. I'm also going to look up your nose with my pen light. Looks good. I'm also going to have you close one nostril and breathe out and breathe in. Okay, and now the other one. All right, I don't see any discharge either. All right, good job. Next, I'm going to review your ears. I'm just going to shine a pen light in both your ears real quick. All right, I don't see any redness or extra earwax. Any other discharge? Good. All right. Did you have any trouble hearing me when I asked you all those questions and explained things? Okay.
No.
Do you use any hearing aids?
No.
Okay. Next, I'm going to inspect your mouth. I'm looking at your lips. They look pretty good. No cracking, no blistering. Next, I'm going to have you smile. I'm going to check your teeth and your gums. All right, red and symmetrical. I don't see any cavities or missing teeth. Do you wear dentures?
I do not.
All right, next I'm going to look at your tongue. If you would stick your tongue out for me. All right, I'm going to look at your hard and soft palate. All right, they both look good and red. Next, I'm going to check your trachea. If you'll tilt your head back for me, it looks symmetrical and centered. If you could take a deep breath in and out for me. All right, that's even. Next, I'm going to listen to your heart, and I'm going to first just listen, and then I'm going to listen to your breath sounds, and I'll have you breathe in and out when I say, okay? I'm going to start with the aortic one, your heart. I'm going to listen for 10 to 20 seconds. Listen to the apical pulse for a full minute. Next, I'm going to listen to the sounds. take a deep breath for me. Nice and clear. Another deep breath for me. Another deep breath. Good. Listen to the sides. Nice deep breath. Alright. Now I'm going to listen to the back side, everyone. So you lean forward. Thank you. Move your ponytail. We'll listen to light points. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. I'm going to fill your chest and have you breathe in and out for me. Don't want any masses. Okay, I'm going to listen to feel the back side. Deep breath. Thank you. Okay, good job. Does anything hurt whenever I was feeling? Okay. Next, I'm going to feel for your pulses. I'm going to start with carotid. I'm going to work my way down. Okay, I'm going to start with this side. All right, now I'm going to do the other side. I'm going to feel both brachials at the same time. And then your radial. All right, and then I'm going to feel the femorals. And then I'm going to do your popliteals. And your pedals. And then posterior tibialis. All right, you have really good pulses. I'd say it's about a 3 on the scale.
Thanks.
Okay, next I'm going to look at your hands and feet. I'm going to check your skin turgor. I'm going to pinch the back of your hand. You have good skin turgor. I'm going to press on your nail. Good cap refill. Okay, and then I'm going to do that with your feet. I'm going to press on your toes. Good cap refill. Okay, and then I'm going to check for edema. No, it didn't edema. It's good. Okay, next I'm going to check your temperature of your skin in just various places. Your hands felt really good. You don't feel like you're running your temperature. Have you had any fevers or chills lately?
No.
Okay. And then I'm going to listen to your bowel sounds next, if that's okay. You don't have to breathe in or anything. I'm just going to listen. When's the last time you had a bowel movement?
Yesterday?
Yesterday. And was it formed or?
Yes.
And is that normal for you?
Yes.
Okay. All right. Have you had any bowel surgeries?
I have not.
Okay. I'm going to look at your bowel, your abdominal, and I don't see any scars or anything. Okay. Now I'm going to listen to each section for 10 to 20 seconds. I hear your bowel sounds. They're good. They're active. That's good. Okay. And then I'm going to lightly press on your tummy, okay?
Mm-hmm.
Does this hurt when I press on you?
No.
Okay. I don't feel any abnormalities or masses. Good. All right, I'm going to have you lean back. I'm going to palpate your bladder above the symphysis pubis, just for any distension, okay? Did that hurt at all?
No.
Next, I'm going to check your genitalia. Have you noticed any odor lately? Okay. I don't see any abnormal lesions, tears, or odor discharge, any abnormal. Next, I'm going to, I've already inspected some of your skin. I did the skin turgor and your nail beds. I'm going to look for any other scars. You said you hadn't had any surgeries.
No.
Can I look at your forearms? I noticed some tattoos, okay. All right, and then I'm gonna look at your legs. Just a little scarring right there, and a little tiny bruise there. All right, Next, I'm going to check your musculoskeletal system. I'm going to push and pull on you just a little bit and have you do various things. Just let me know if anything hurts. Okay, I'm going to put my hand on the side of my face. If you can turn into there, okay? And then now this side, okay? And then if you look to your left and if you look to your right, did anything hurt?
No.
Okay, I'm going to look up and then down. Okay, I'm going to place my hands on your shoulders and then try to push up. And then I'm going to have you raise your arms out. And then I'm going to have you turn your palms up and down. Okay. Push your hands down. Did anything hurt?
No.
All right. And then if you'll turn your hands up and then down again for me. Okay, good job. I'm going to have you stand up. I'm going to have you put one leg out slightly and have you push like you're pushing on a gas pedal. Push down and then up. Okay. And then on the other foot. Okay, I'm going to have you squat for me just a little bit and then come up. Anything hurt?
No.
Okay, I'm going to have you squeeze my hands. All right, both even and symmetrical. Next, I'm going to have you turn around for me and I'm going to check your spine. If you'll just bend over and touch your toes for me. And I see an even spine. All right, you can stand up for me slowly. Next, I'm going to have you walk that way a few steps and turn around and come back. I'm checking your gait. Do you use any assistive devices like canes or walkers? All right. And then you can have a seat. Do you have any questions for me?
No.
Okay. Next, then I'm going to wear away my gloves, do hand hygiene. I'm sure my bed is in the lowest position, it's locked, and that the call bell is within reach. I'm going to leave the room and I'm going to document on my assessment.